St. Joseph's Hospital Total Joint Replacement Program, your guide to total joint replacement surgery. Welcome to St. Joseph's Hospital Total Joint Replacement Program. We are pleased that you've chosen our facility for your total joint replacement surgery needs. Our goal is to return you to the best of health as soon as possible. Today we're going to provide you with information to help you become familiar with the process involved with your surgery and hospitalization. We hope to answer your questions. I'm an orthopedic nurse navigator. The orthopedic nurse navigator is a registered nurse who will help coordinate your care to guide you and your family to assure a positive experience. St. Joseph's Hospital is promoting a healthy lifestyle. There are no smoking areas in our facility. If you feel you need a nicotine patch for your stay, please notify your surgeon. No surgical procedure can take place without us first taking a good look at your overall health. Your primary care physician will provide medical clearance. For any pre-existing conditions, you may be asked to get clearance from that particular specialist. Pre-admission testing will need your medical and surgical history along with the most current medication list. You'll receive specific pre-surgical instructions, which include nothing to eat or drink the midnight prior to surgery. We'd like you to stop any vitamins, anti-inflammatories, and fish oils 5 to 7 days prior to surgery. Tylenol can be used as an alternative. If you take a prescribed blood thinner, you'll receive specific instructions on when to stop. If you are instructed to take medications on the day of surgery, we do ask that you take it with just a sip of water. The HIPAA soap will be provided to you at your pre-admission testing appointment, and that is to be used the shower before surgery. Please do not apply this soap to your face or peri area, and we also ask that you do not shave 48 hours prior to surgery. You'll receive a phone call from the scheduling office the business day prior to surgery. We finalize our schedule late in the afternoon, so you'll get a phone call late afternoon, early evening. Please note, for any Monday surgeries, you'll receive that phone call on Friday. Our goal is to optimize your health prior to surgery. Please report to your physician if you have any changes in your condition. We also would like to respect your wishes. If you have a living will or advance directive, please bring in a copy on the day of surgery. If you would like to fill one out, we can gladly provide you one as well. Healthcare benefits are constantly changing. This is a great opportunity to become familiar with your policy and what that means. Our goal is to have everything set up for you prior to discharge. We have a home health coordinator that will set up all of your home health needs, a case manager or social worker if you do not meet criteria for a safe discharge home, and that includes arrangements and transportation. We also have the unique opportunity to have a Publix pharmacy right on campus, and we will fax your medications down for bedside delivery. Lastly, we have a durable medical equipment person that will provide the following pieces if you do not already have them at home. For all total joint replacements, these are the 2 pieces of equipment that your physician will order for you. Please note to the left is a 2-wheeled walker that's 2 wheels in the front, stoppers in the back, and then to the right is an elevated toilet seat or commode. We do ask for you to take the bucket out and put it over your toilet. Both of these pieces of equipment are adjustable. We have the unique opportunity to have a Publix pharmacy right here on campus. On the day of discharge, we'll fax down the hard copies down to the pharmacy, and they will deliver it right to your bedside. Most of our patients will stay one overnight, but criteria for discharge will determine that. In some cases, if you have surgery early enough in the day and you exhibit the following criteria, you may actually be able to be cleared for discharge. We want to see that you're able to safely navigate, being able to get in and out of bed, walk about 100 to 150 feet, be able to ambulate to the bathroom, get on and off the toilet, and manage any stairs you have to get into your main living area. Be prepared to answer the following questions for your physical therapist. The more they know about your home, the better off you'll be when you do get there. They'll want to know how many stairs you have, do you have railings at those stairs, how high are your chairs, your toilets, and also what is the height of your bed, which side do you get in and out of. There's a number of things that you can do to prepare your home for surgery. Preparing meals ahead of time or just having takeout numbers when you get home, making sure there's a clear path from your bed to the toilet, from your bed to the kitchen, your bed to the living room, removing any clutter items to avoid falling. Your walker is about 2 feet wide, so you're going to need about that much space to navigate through your home. Removing any small area rugs is never a bad idea. Arranging frequently used items to be on the counter and even hip height at your refrigerator. Installing night lights, especially in the bedroom for that 2 o'clock in the morning bathroom break. Having a firm chair with arms that'll assist you with getting up and down a little bit more independently. Making any arrangements for pet care or paper delivery or mail. You will also need to make some arrangement for your 2-week follow-up appointment. And last but not least, any yard work or laundry that needs to get done. Try to get that done ahead of time or see if someone can come in and assist you during this time frame. What to bring to the hospital? If you use a CPAP machine for sleep apnea, we do ask that you bring that machine, including any distilled water that is needed. You're welcome to bring special toiletries, but we do have everything that you'll need. With regard to electronics, most people will bring a cell phone, but we do have free Wi-Fi, we have smart TVs, so the need for an iPad or a tablet, it's up to you, but know that we do have access to the internet if you need to. What not to bring? We really want to discourage lots of money, jewelry, valuables being brought to the hospital. And then we do ask that you don't bring any home medications. If you do have any concerns, my number is provided at the end of this presentation. And please feel free to call so that I can call pharmacy and see if your medication in question is formulary. Keeping you safe is our #1 priority. Be prepared to provide your name and date of birth as we compare this information with your armband on all clinical interactions. Hand washing is the #1 thing that we can do to prevent the spread of infection. Please know that our standard of care is washing our hands and/or using alcohol solution before and after care with you. We want to perform the right procedure on the right patient at the correct site every time. We'll ask you to be involved in this process by identifying your surgical site and confirming the site that your surgeon marks. On the day of surgery, please take the B as in boy elevators to the 2nd floor. Once you get checked in, you'll be escorted to the pre-op holding area. You'll be provided a gown along with chlorhexidine wipes, which is the main ingredient of the medicated soap that you used at home. Same rules apply. Do not apply this to your face or your peri area. You'll have an opportunity to speak with anesthesia about your anesthesia details, including nerve blocks. Surgery is usually about 1.5 to 2 hours. Then you go to the recovery area and stay there for about 1 to 2 hours. We just want to ensure that you can breathe on your own, have stable vital signs, and have good pain control. From there, you'll move to our orthopedic unit. We'll continue to monitor you frequently and ensure that you have good pain control. Depending on your surgeon and pre-existing conditions, You may also be seen by a hospitalist who will medically manage you while you're here with us. This is an example of a communication board that we use here at the hospital. Basic information like today's date, your room number, your nurse, your patient care tech, and so forth. Underneath the patient care tech is where physical therapy will write what your transferability. This allows you to be safe. If you call to use the restroom, we know whether we need 1 or 2 team members to assist. Additionally, I'd like to point out where it indicates pain medication. Your pain medication is given to you on an as-needed basis, and your nurse is to write down when the next time you have it available to you as needed. Please note that physical therapy will look at this board to arrange when is the best opportunity to work with you so that you have the optimal amount of effectiveness of your pain medicine. Secondly, please know that this medication, any of the narcotics, are on an as-needed basis. So you'll have to use your call bell or have a constant conversation with your nurse to know when it is that you are going to request this medication. It is on a request basis. Orthopedic surgery does put you at risk for blood clot formation. Some interventions include walking with physical therapy on the day of surgery, placing sequential compression devices, having you do ankle pumps, and the day after surgery starting on some anticoagulant therapy. Physical therapy will work with you on the day of surgery if you get to the unit before 6 p.m. They'll also work with you the following morning and determine whether you are safe for discharge. If they feel you would benefit from an additional session, that additional session will be provided to you. We'll also provide you with an incentive spirometer, and we encourage that you use that about 10 times an hour. Pain management is always on our radar. We do use 0 to 10 pain scale and use a multimodal pain management plan, which includes narcotics and non-narcotics. In addition, we do have aromatherapy available to you upon request. Ice therapy is also used to help minimize pain and decrease swelling. After surgery, we'll provide you with some ice chips and advance your diet as appropriate. After a total joint replacement, you will be categorized as a fall risk. We will have the bed alarm on, chair alarm on, and always have your bedside alert system to call your nurse. Please call for assistance. We are happy to help you. Discharge day does vary from one patient to another. We do have some patients that actually go home on the day of surgery, but the majority will stay overnight, and as long as all the criteria is met, will be discharged that morning. Pain medication scripts will be faxed down to the pharmacy for bedside delivery. Most common side effect of narcotics include constipation, nausea, vomiting, and itching. This is why we suggest using stool softeners in conjunction with the narcotics. Aspirin is the most common blood thinner that is prescribed after surgery, but if you have a pre-existing condition, a different medication may be prescribed. Blood thinning medication will continue anywhere from 4 to 6 weeks depending on your surgeon. You'll get specific instructions in the hospital. Follow-up appointment will be within 2 weeks generally. We do have one surgeon that likes to see his patients a week after, and you'll again get that specific information provided to you. Driving release will depend on whether it's your driving leg or not. It will be between 3 to 6 weeks. And prophylactic antibiotic. We do ask that you take a prophylactic antibiotic an hour before any invasive procedure, for example, dental work or skin biopsy. Once you are home and your case has been established, you should expect physical therapy to come out 3 times a week for the next 2 weeks. At your 2-week follow-up appointment, you'll then have the conversation with your physician, and generally you'll advance to outpatient physical therapy from that point. Our doctors use a variety of different dressings. These are the most commonly used: Aquacel, a silver embedded dressing; Pico, negative pressure dressing; and Covaderm, gauze with adhesive around it. You'll be given specific instructions based on your particular doctor's orders. After you are discharged from the hospital, you may receive a survey in the mail asking about the care you received while you were recovering in the hospital. Please take a few moments to fill this out. In order for us to provide our patients with high-quality care, we need your feedback. It is appreciated. Thank you for taking the time out of your day to learn more about our total joint replacement program at St. Joseph's Hospital. For any further questions or concerns, you are welcome to call the Orthopedic Nurse Navigator at area code 813-870-4073. Have a nice day.